Welcome to the Enluxtra Knowledge Base. These are the 3 basic rules that will help ensure your optimal success with Enluxtra. Remembering and following them is extremely easy and will definitely help you get the most out of your Enluxtra use. Rule 1. Choose a larger dressing size. Always use a dressing large enough to cover the compromised peri-wound skin and to overlap the healthy skin by at least 1 inch. If the dressing is too small, the skin and wound bed may become macerated and healing will be delayed. Do not cut the dressing to wound size. Peri-wound skin is fragile and vulnerable to infection due to the presence of microcracks and existing inflammation. You must cover the peri-wound skin to protect it from further damage, exogenous bacteria, and to prevent the infection from spreading. Do not use skin preps under Enluxtra dressings. You may trim Enluxtra if it needs to fit into a difficult area or if it interferes with body part movement. Rule 2. Ensure full contact with the wound bed. Enluxtra must be in full contact with the wound bed with no tenting. If there is a gap between Enluxtra and the wound bed, the dressing material will not be able to absorb the exudate. This will cause slough formation and maceration of the wound and peri-wound area. If the wound has any depth, apply Enluxtra, press it down with your finger, place folded gauze pads on top, and apply a wrap. Press it down again to make sure there is no tenting, and Enluxtra will stay in full contact with the wound bed at all times. If you press down and feel empty space between the dressing and the wound, add additional gauze and compress or tape down to contour Enluxtra to the wound bed. For deep or tunneling wounds, pack the cavity with a wound filler and apply Enluxtra, making sure its undersurface is touching the filler, wound, and peri-wound area, as well as healthy surrounding skin. Do not use fillers that shrink to avoid gaps forming between the dressing and the wound. Do not use thick pastes that block vertical draw, as this will cause wound maceration. Rule 3. Change more often initially. Enluxtra is designed to stay on a wound for up to 7 to 10 days. However, when you first start using the dressing, it is best to increase wear time gradually to clear the wound from any non-vital tissues such as slough and necrosis, since these semi-solid products of autolytic debridement may clog up the surface of the dressing. For heavily draining or very sloughy wounds, initially change Enluxtra every day until the drainage subsides. For all other wounds, change every 2 to 3 days. You may reduce the change frequency for up to 7 to 10 day wear time when the wound becomes slough-free. Do not forget to always change Enluxtra before the exudate reaches the dressing edge. So, key rules to remember. 1. Choose a larger dressing. Enluxtra must cover compromised peri-wound skin and overlap the healthy skin around the wound by at least 1 inch. 2. Ensure full contact. Enluxtra must touch the wound bed or packing material at all times. 3. When you start using Enluxtra, change more often initially, every day for heavily draining or very sloughy wounds, and every 2 to 3 days for average wounds. When the wound is slough-free, the change frequency may be gradually reduced to once or twice per week. Remember to always change Enluxtra before the exudate reaches the dressing edge. Thank you for watching. If you would like to register for a free live webinar with a member of our clinical team, please go to enluxtra.com/webinar. For more information, or if you have any questions, please do not hesitate to contact us. We are happy to help. Thank you for learning, and happy healing